All right. Welcome everybody to day 2 of our 12th annual Medical Aesthetics Bazaar. Thank you for tuning in to our sit and sips today. Right now, our sit and sip is with our wonderful dry eye clinic director, Dr. Vin T, and he's going to talk about IPL and how he treats dry eye with that amazing treatment. Before I let him take it away, I'm going to just talk about our giveaway real quick. We are giving away a free dry eye relief kit worth around $200. Lots of goodies in there that will really help you find relief from your symptoms, especially in between those dry eye IPL treatments that Dr. Dang is going to talk about here in a minute. So make sure to let us know in the comments if you would like to be entered for a chance to win that dry eye relief kit. And then make sure you stick around until the end of the session in order to find out if you won. So if you're not logged in right now to do any commenting, then go ahead and send us an email, info@empireeyeandlaser.com, so that way I can also enter you that way. And also, if you have any questions for Dr. Dang as we're going, please leave those in the comments, and I'll kind of let him know those questions so he can either address them as we're going or towards the end. So without further ado, I'm going to hand it over to Dr. Dang.
Hi, everybody. Thanks for joining us today for our Empire IPL sit and sip. So today we're just going to go ahead and do a quick, talk about dry eye, right? So we live in the valley in Bakersfield, right? So I tell all my patients that you pretty much have dry eye until proven otherwise, because a lot of patients, don't understand that, the symptoms that are associated with dry eyes, the more common symptoms of like dry, irritated, scratchy, the feeling like there's something in your eye, like you have maybe even sandpaper, or even if your eyes are kind of bloodshot red. All of those are sort of the more common symptoms, right? One of the lesser known symptoms is actually blurry vision, right? So a lot of patients, they come to us and they say, hey, I feel like my prescription has changed a little bit, and I feel like I need a new pair of glasses. And then after we check them, we actually find that their prescription hasn't changed, but we find that the surface of their eye is actually scratched, and those scratches are actually related to the dryness itself. And when you have scratches on the surface, it's kind of analogous to having a dirty windshield. When your windshield is dirty, you're not going to see very clearly, and it won't be clear until you sort of turn on the wiper blades and turn on the washing fluid to kind of clear the blurry vision. So that's a lot of patients don't realize that blurry vision is actually one of the first symptoms, even before the scratchy feeling or the dry feeling or the burning feeling. And a lot of people actually don't experience those until sort of in the later stages. So why is it such a big deal, right? We live in a world where it's a lot of the female patients have cosmetics, right? So I talked to a lot of them about right now one of the hot topic is eyelash extensions, right? And I'm sure you guys have seen it, in the teenagers and even in adults. They feel like it's a simple, easy fix. You get permanent eyelashes on your eyelashes, so that way you look pretty all the time. You don't have to use mascara, you don't have to use eyeliner. You can literally roll out of bed and be ready to go. Unfortunately, those eyelash extensions actually harbor a lot of bacteria, and if you go to an esthetician that doesn't use good glue, the glue ingredients may contain formaldehyde, and formaldehyde, if some of you may not be aware, actually are what they use to preserve dead bodies, right? So if you guys use eyelash extensions, make sure you talk to your esthetician and tell them that is the glue that you're using on my eyelashes, are they formaldehyde free? And ultimately, the best thing to do is to not do eyelashes, but having good lid hygiene is very important. We don't talk enough about it in our field. I know that my female patients like to, do a little bit of lid hygiene because they wear eye makeup, but my male patients, on the other hand, they never touch their eyes. I mean, it's sort of been told that, you're not supposed to sort of rub your eyes, but you should. The same way that you do oral hygiene, it's very important to do lid hygiene on a daily basis. And then our dry eye kit actually will have some of these things to kind of get you started. Pollution, right? I'm sure you guys, if you weren't aware, yesterday we had the worst pollution day in a very long time. I make it a task to check the air quality index on a daily basis, because it's going to give me an idea as to if my patients are going to have a good day or a bad day. And yesterday was terrible. It was in the 500 scale, and that's it was saying that it was hazardous, right? So generally speaking, in Bakersfield, where our air quality is not the greatest, and then when it's not the greatest, it's going to definitely contribute to the environmental factors that we talk about that causes dry eyes. I'm sure some of you guys, if you travel out of this valley and say you go to Pismo Beach or Morro Bay, you notice right away that your eyes don't bother you as much. And that's the environmental factors, right? The air quality is better. You've got the marine layer, which means increased humidity levels. You don't have the same allergens out there that are causing the irritations. So all of these things play a huge factor. So when we talk about like the tear film, right? So there's sort of like these three basic layers to the tear film, right? So there's the aqueous layer, which is sort of like the tear film layer that you're talking about, right? The amount of tears. On top of that, you actually have this lipid layer. Now, this lipid layer is actually this oil that actually serves as a protectant. And what it does is that without oil, whenever you get exposed to any sort of fan or ceiling fans or the AC vent or things like that, what happens is your tears evaporate very quickly. And when they evaporate very quickly, that's when you go like, oh man, can you turn that fan away from my face, because it just irritates my eyes. Or even sitting underneath the ceiling fan while you're watching television is going to cause some irritation. So that's why you have to have a good balance between all three of these layers in order to not suffer from this dry disease condition. Going into the lipid layer, what we have is, so all along the eyelid margin, on the top and on the bottom, you have these oil glands. Well, these oil glands are responsible for secreting oil, and that oil, like we talked about, it acts like a barrier. But it also acts like, when I talk about it, I say that, when you have water, which is the tears, things are pretty slippery. But then when you add water and oil on top of that, it's even more slippery. So then when your eyelid goes over your eye, that's how you're not having sort of that sandpaper sensation on your eyes. And the oil glands are extremely important for that. A lot of doctors out there actually don't take a look at those oil glands layers. So that's why, sometimes what they'll do is they say, oh, well, you suffer from dry eyes, here's some artificial tears. And you try the artificial tears for a little bit, gives you very, very temporary relief, but they're not addressing the issue of the oils, and that's why it's very important. So that's one of the things that, in order to help with the dryness, is we like we said, we have to use preservative-free artificial tears, and that's actually one of the items that we're giving away. When it comes to artificial tears, you go to the drugstore and you look, and there's a gazillion brand. There's the Refresh, there's the Sustain, the Blinks, and you don't know which one is good, which one's bad. You got the Visines, the Clear Eyes. We typically like to stick to preservative-free brand types of artificial tears. And generally speaking, preservative-free artificial tears are ones that comes in a vial. We actually have a special brand here that's called Freshco that actually is preservative free, but it also comes in a bottle, because obviously we have some older patients that have like a little bit of arthritis issues and they can't really squeeze the vial. They actually like squeezing the bottle. And then on the other picture here, we have a picture of a Brutta mask. A Brutta mask is a good at-home warm compress therapy, right? So when we talk about the oil layer, when oil gets cold, it gets hard. It's kind of like bacon grease, I say. Well, how do you turn bacon grease back into oil? Well, you have to use heat, and that's what this Brutta mask does. It's a microwavable, hygienic, reusable mask that you can stick in the microwave for about 25 seconds, and then you put it over the eyes for about 10 minutes on a daily basis. And what that does is it essentially heats up the oil glands and prevents them from clogging. Now, what we talk about is that those were sort of the home therapy. When we want to do sort of the better, more advanced therapies, we have to talk about things like something like IPL. Now, IPL was first developed for dermatology, and IPL stands for intense pulse light. And what it does is that when it was first developed for dermatology, it was used to treat this condition that was called rosacea. Now, rosacea is an inflammatory skin condition that causes you to have like the red, sort of rosy pink cheeks without having to put any sort of blush on. Well, that rosy pink cheek appearance, what it does is it causes inflammation on your cheeks. Whenever you eat, spicy food, or if you get exposed to too much sunlight, it causes the rosacea to get worse. So what they found was when you do the IPL treatments on the cheek there, the patients would come back and say, "Hey, doc, I know you've been treating my skin condition, and it's but you were nowhere near my eyes. How come my eyes suddenly feel better?" And then that's what they found. But while we're treating the cheeks, we're able to sort of decrease the inflammation that's on the cheeks, and by decreasing inflammation on the cheeks, you're also able to decrease inflammation in around the eyes. Now, here is sort of a quick video of me doing the procedure on the patient. It's a very, very bright procedure, so that's why it stands for intense pulse light. And then what we have is these little special shields that go in the inside of the eyelid to protect the patient's eyes, because what happens is if you don't, the laser actually penetrates the eyelid and it would potentially damage the eyes. And that's how we're able to sort of treat the oil glands themselves. Now, in the picture that you see there on the right there, you'll see that what we're doing is we're squeezing the oil, and that's what I was talking about is like when oil turns into like grease. This is absolutely not what you want, right? So when the oil kind of turns into this hard substance, that's bad. So then what can that lead to, right? So then the infamous sort of styes, right? So a stye is essentially, a pimple that you get on the eyelid, right? So a lot of patients will come in with like saying that, oh, they got red eyelids or they've got a bump on their eyelids and those type of things. And that the styes are essentially these oil glands that get inflamed and then they get infected by bacteria from the eyelids and eyelashes. So that's why it's very, very important on a daily basis. You got to clean your eyes, right? It's the same way that you floss your teeth every single day to prevent cavities or prevent that tar plaque buildup. You got to do that for your own eyelids and eyelashes to prevent, these styes. But sometimes that's not enough, and that's why we have to use this particular technology. So this is sort of like a slide that kind of shows you what the rosacea is kind of looking like, right? So then what the laser does is it targets those blood vessels and it actually shrinks them. And by shrinking those blood vessels, you're actually able to get rid of the redness, and that's how you're able to decrease the inflammation. But also what they found was that it's able to sort of stimulate the oil glands within the glands to tell them to start, jumpstart them. I tell them that, it's all these years your oil gland has been sort of stalled. It's like an engine, right? You need to jumpstart the engine to get them going, and that's what the laser does. And here, if you get a close-up view of those blood vessels, the inflammation vessels on the eyelids, the arrows just basically point at all those tiny, tiny little red vessels on the eyelid margin, and those red vessels are basically the signs of inflammation. One quick tip for my female patients out there. It's very, very important that if you're going to apply eyeliner, you got to first make sure that the eye makeup that you're using is a clean brand. And we carry the clean brand here in the office. It's the Jane Iredale makeup line. And it's least toxic, less likely to clog your lens. But when we're talking about, applying makeup, always try to avoid putting it on your waterline, because as you can see, the arrow actually points to the opening of your oil glands. Now you can imagine that if you put eyeliner on your waterline, what's that going to do? Well, that's going to create a blockage of the flow of the oil glands, and that's going to just essentially exacerbate the condition. So for this special patient appreciation event on our MAB, we have a little a discount on our series of IPL. So typically what we do is 4 treatments every 2 weeks apart. Typically we charge $1,300, but because of our special MAB pricing, we're going to give you a $200 discount. So go ahead and give us a call at 661-325-3937 and ask for the IPL discount there.
Is it very painful, the procedure? What does it feel like?
No, so that's a great question. So the procedure feels it's very. A lot of patients, talk about how bright the treatment is, and granted that that's exactly, they're more startled by the brightness of the treatment. The treatment itself, it feels like I've gotten the treatment myself because I also suffer from dry eyes, and that's why I'm so passionate about it. And it feels like a hot rubber band, snap on your face. If any other patients out there have had any sort of like laser hair removal treatments, it's very, very similar laser, just a different wavelength. So it feels like a little hot rubber band snap on your face, and we just do a bunch of them on your cheeks, and then we do them on your eyelids.
And then is there another part to the procedure, or is it just that light portion?
Yeah, so after we do the light therapy, you should feel like your skin has been sort of sun kissed. So it'll feel a little warm, almost like you have a sunburn, but not a sunburn. So then, the heat that's been generated from the IPL treatment will also instantly melt, that grease that we were talking about. And by melting that grease, then afterwards, what we do is we gently push on your eyelids. And by pushing on the eyelids, we're able to express that oil that's been stagnant and that's been there. So after each treatment, we do a laser treatment that takes about 5 to 10 minutes, depending on how many area that we treat. And then afterwards, we go ahead and push on the eyelids to kind of express that oil that we want to get rid of, the bad oil.
And how long do the results or the relief from this treatment last?
Yeah, so then we're the only office in town that provides this treatment, and the literature out there indicates that the results are anywhere from 6 to 9 months. Afterwards, what will happen is you'll start noticing a slow decline in your symptoms. Everything will be good after you have the therapy, and then over time, you'll notice that just I'm still using my eye drops, I'm still doing my supplements, but my eyes are starting to feel a little bit worse. And then at that point, that's when you'll notice your eyes will say, okay, hey, there'll be a slight regression. And that's when you'll have to come back for a maintenance treatment. And the maintenance treatments, depending on the severity of your condition, could be anywhere from as early as 3 months, which is where I fall in that category, or as long as once a year.
So a series of 4 treatments is a good starting point that would cover a lot of what a lot of people will need initially.
Yeah, absolutely. Yep. So, when you come in for your dry eye evaluation, I'll talk to you about, the type of dry eyes that you have. And not everybody needs IPL. But, I want to say that the majority of the people do, because they have some form of, inflammation in their eyes, and then some oil deficit. And then, we typically like to start out with 4, and then if after we do our 4, then we sort of reassess. In my more severe patients, we may have to do another series of 4. In my less severe patients, after 4, they're great. So it's I can tell you that for myself, I am now in the maintenance phase, and I've gotten probably 14 treatments already. So it's just now I'm on every 3 to 4 months I get a treatment. And actually, I'm due right now. I'm due for a treatment. So I'm training my resident to do the treatments for me.
So can't people just take eye drops, over-the-counter eye drops, to help with dry eye? I mean,
unfortunately, like we talked about, and most of the patients have already experienced this. By the time they come and see me, they've already tried, 2 or 3 different types of eye drops, and the eye drops, they just give you very, very momentary relief, right? So you're putting you're trying to fix the issue with a Band-Aid, where it's something that's whereas with the IPL treatment, you're actually treating the underlying cause. You're treating the inflammation. You're treating the oil glands. You're doing something. You're changing things physiologically. Eye drops, they're just eye drops. You put them in, makes you feel good, and that's the purpose, right? It's to help you flush out things out of your eye, but it's not really doing anything in the background. It's not changing anything physiologically. So you're still going to, after 10-15 minutes of those eye drops, you're going to feel bad again, because you're not treating the underlying cause.
So what's in the dry eye relief kit?
Yeah, so that's a great question. So and today, for the participants, we're going to include one of those Brita masks, which is, that warm compress mask that I talked about. One thing that I didn't talk about is omega-3 supplementations, right? So one thing that's very, very important is having a lot of omega-3s in your system, because we don't get that, our body doesn't produce any omega-3, so we have to get it nutritionally. Ultimately, the best thing to get omega-3s is directly from the food source itself. So I'm always a big proponent of, making sure you eat, 3 servings of fish per week. It could be, anything from salmon, tuna, tilapia, sardines, if you like, to, like crab and shrimp and things like that. But if you can't, take 3 servings of seafood per week, whether because you don't like it or you don't feel like it's fresh, then that's when supplementation comes into place. So we're giving away 1 bottle of Hydro Eye. Hydro Eye is a specific formulated omega-3 and omega-6 supplements that's been indicated specifically for dry eyes, and I take this myself. The next item is a bottle of Fresh Coat, and Fresh Coat, like we talked about earlier, is a preservative-free bottled artificial tears. So it's great for older patients that have issues squeezing the bottle. The second, the other item is a Zocular foaming cleanser, right? So I talked about how important it is to have good lid hygiene, right? But then you tell us that I have to clean my eyes, but then what am I supposed to use? And that's where this Zocular foaming cleanser is great for. It's a foaming cleanser that you can use in the shower. It's gentle, where it won't burn the eyes, and it's specifically designed for the eyes, to just gently remove the debris, remove the biofilm, remove some of the bacteria that could be causing some of the styes. And then the final item is actually a makeup remover. Right, so we talk about how we know that makeup now is contributing to eye irritation. We know that mascara and eyeliner, same thing. You have to get a clean eye makeup. But the thing is that just like your mother told you, it's very important to not sleep in your makeup and eye makeup. And then the reason why is because it clogs up the oil glands. It creates more irritation, causes more inflammation. So it's very, very important to be able to use something clean, and that's what this We Love Eyes makeup remover does. It is a tea tree oil based makeup remover that does an excellent job at removing all forms of makeup on your eyes. So that's our dry eye relief kit right there.
All right. We are ready to announce the winner. Let me pull that up here for everybody. And spin the wheel. And it looks like it's going to be Stacey Walrath. Stacey Walrath, congratulations. Please email me at info@empireinlaser.com with your contact information so I can get this out to you. Thank you so much, Dr. Dang, for joining us today. We really appreciate your time. You're taking your time out of your busy clinic day to come share some information about IPL with us. And thank you, everybody who tuned in. We're going to have more tomorrow at 12. So courses and MAB is going on all week. Thank you, everyone.